Okay, well, with no further ado, I'd really like to welcome Roberta Ceccheti to our webinar on advocacy in child protection. Roberta has 18 years of advocacy experience, including over 12 years with Save the Children at the national and international level, and has advocacy achievements within the area of child rights and child protection. Roberta is currently the Senior Advocacy and Policy Advisor of the Child Protection Initiative, based in Geneva. She's been working on child protection and child rights advocacy both with Save the Children and other NGOs, networks, and interagency groups. She has substantial knowledge of the UN human rights and child rights machineries, and in fact headed the Save the Children Geneva office for 5 years. Roberta also has been able to really link the humanitarian and the human child rights world, creating strategic bridges between them. She is a solid child rights-based approach to advocacy and the ability to bring everyday reality of children to the global level. So I'm really excited to welcome Roberta to this webinar and to thank her for her time. How are you, Roberta?
Thank you, Shani, and thank you, everybody. I'm very well, although when I hear somebody reading my bio, I feel very old. All these years. Well, clearly, I'm very, very excited to be, having this webinar with you, all of you.
Well, old woman, you definitely come with tons of institutional memory and experience, and that's really what we want to pull out of you in this webinar today. Thanks again for joining. So, child protection, it's one of our global initiatives and something that Save the Children has worked on for decades, almost a century nearly. Now, and it'd be great to hear from you, what are actually the child protection global advocacy objectives?
Yes, we have 4 global advocacy objectives that we have established altogether through a process of consultations and are linked to the child protection breakthrough. And you will remember that the child protection breakthrough says that what we want to achieve is that all children thrive in a safe family environment and no child is placed in harmful institutions. So the steering group of the Child Protection Initiative back in 2013 said that we want to have 4 limited numbers of advocacy objectives that were achievable, memorable, and that were linked to our breakthrough. And therefore we through that process of consultation we came up with 4 of them. And Shani, maybe you can scroll down to the next slide if people can see it. So the first advocacy objective is linked to the pillar of keeping children safe, especially in their families and their family environments. So here what we would like to achieve is that by 2015, so all these are objectives to be achieved by 2015, so the end of the current strategic period, we want 8 additional states to ban physical and humiliating punishment of children in all settings. The second is linked to strengthening families and prevent unnecessary separation of children from them. And here we want that at least 10 states adopt and implement laws and policies that promote family-based care in line with the international guidelines for the alternative care of children. The third objective is linked to our emergency response, and it is focused on unaccompanied separated children. Here we want to ensure that in emergency situations, states commit to provide assistance and support to unaccompanied and separated children when relevant. And it is important to underline that where relevant, because we know that specifically in conflict situations, some countries and governments are responsible for child rights violation in the first place, and therefore we can't just expect them then to be responsible also for the remedial of them. So where relevant is particularly important. And then the fourth advocacy objective is linked to the current negotiations of the framework that will replace the Millennium Development Goals, and we would like to see that framework to...
Close are we to achieving these objectives by the end of 2015?
Yeah, of course, we have developed an M&E framework for to be able to monitor the achievements and setbacks according to each of these advocacy. And we went back to 2012 to establish a baseline. So from when do we start to count, right? So in 2002, we had 33 countries who had a complete ban on physical and humiliating punishment. And the countries where we want to achieve these objectives are the countries, of course, where we have programs or a significant presence also through partners where we can have influence and therefore carrying out advocacy that can achieve that result. So there have been countries that have banned corporal punishment of children. This year has been particularly a good year. But for Save the Children, we have achieved these objectives in 3 countries this year. There are all Latin American countries. It's Brazil in June, it's Bolivia in July, and Argentina, the most recent one, in October.
Fantastic news there, Roberta.
Yeah.
Well done, Latin America.
Yes, Latin America really is paving the way. There are other countries around the world that have aligned themselves. I think that also the pressure that is now and the attention that is on coming from the global agenda, especially in negotiating violence against children targets in post 2015, is also pushing government to deliver and demonstrate their commitments, because this is not, of course, something new.
Great. So you're saying the post-2015 framework is actually an opportunity to also push governments to make commitments in the area of corporal punishment. Is that how you see it?
Absolutely. Of course, child protection, violence against children is an area and of concern that has seen a lot of attention in the past. One can think of the UN study on violence against children that was released in 2006. Before that, there was the Gracia Machel study on children and armed conflict. But the fact that there wasn't a specific target in the MDGs, looking at protecting children from violence, of course, has diverted also some attention, especially also funding from donors and also investment by government in child protection programs. So now, this we see this framework that is being negotiated now really as a great opportunity to avoid having this gap again, where having some targets in that framework will transform into focus, into more resources, into more data, into more action and commitments by government.
Excellent, excellent. So now every global initiative has a breakthrough, and you've talked us through the objectives, but can you clarify that breakthrough and how that relates to kind of the interaction between what we call our advocacy and what we traditionally call our programs? And if that applies in the child protection GI.
Yes. So of course the breakthrough is our right, what we would like to see the world looking like for children, and in particular in this case, their protection. And we have broken down that breakthrough in 3 pillars. So how do we ensure that children thrive in safe family environments, and that there's no use of institutions when they are in need of alternative care? We see that happening through 3 approaches or ways. First of all, we have to ensure that children are safe where they spend most of their times apart from school, which is in their families. So ensuring that they grow up there and feel safe and protected. Secondly, that when alternative care, and this is the second pillar, is necessary because they are not safe and cared in those families, that alternative care is provided in safe family environments. And then thirdly, when they are separated from their parents or families in conflict situations, that there is also and there is an insurance that they keep being protected, and there is an environment that will allow them not exposed to further or heightened risks. So we know Save the Children across the board that we can achieve these objectives through programs and direct interventions, but we also know that we can achieve this through advocacy. And in order also to ensure that the protection of children is not just a direct effect of children intervention, but it is a stakeholder, a government, and intervention and responsibility. And therefore, these objectives are somehow the policy and advocacy leg of these 3 pillars that would aim at achieving the same results.
Excellent, excellent. I think that was really helpful. Listeners, if you've got any questions or any examples of this that you'd like to share with myself and Roberta and the rest of us, please feel free to unmute your microphone or to type in the instant message section of the link webinar. Roberta, that sounds great. Can you give us some practical examples? And before you do that, am I supposed to be on a specific page of your slide? I'm bouncing around here and I don't want to confuse people.
No, maybe you can move to the next, and then I can give examples on of care reforms. So this is what we have achieved this year in terms of objective number 2. So ensuring that children are cared for in safe family environments in line with there is this UN guidelines on how children should be provided for care and alternative care. So we have engaged with governments in these countries. And in Indonesia, and I was there when this happened, the Ministry of Social Affairs, for example, adopted a decree on family-based care this year in April. And this is, of course, doesn't have the power of a piece of legislation, but it actually spells out what are the different forms of alternative care that should be in place, that first and foremost children should be cared for in their own families, and where it is not possible, in family-based alternative care settings. Why are we doing this work? Because, well, first of all, the Child Protection Program in Indonesia is a signature program of Save the Children, and Indonesia has a country that has 500,000 children living in institutions, where 9 out of 10 have either one or both parents alive. So it's not a problem of orphanhood, it's a problem of economic opportunity educations, opportunities and lack thereof, and then a system that is completely institutionalized and therefore respond to care and protection issues through institutions. So this has been a work that has been going on for 10 years, which started with actually the tsunami response, where we saw a lot of orphanages being built because of that response, and also because of the perception that these children were orphans, and therefore trying to see then across the country, what were the numbers that we were talking about, how in terms of children being there, but also the number of institutions, especially because the majority of these are not state-run institutions, are run by religious organizations, and therefore not being licensed, not being recognized, not being regulated. So that was a big achievement, and it is still ongoing, because we all know that having a piece of legislation or a piece of policy doesn't necessarily translate automatically into changes for children, and there is work to be done to secure implementation and resources.
And Roberta, coming to that point of kind of saying legislation and laws don't necessarily guarantee delivery, what are some of the things, you've put down here on this PowerPoint, which is a great representation of some of the work, a lot of guidelines and decrees. What are some of the real kind of concrete steps that we take as Save the Children after some of these kind of light policies? I don't know exactly what the expression is, but these policies that are not law are put in place. How do we influence government to actually deliver on these? And if you could give us perhaps some really practical examples of action, so that while people in country offices are thinking about developing their strategies around this, they can think of some of the actions that other countries have taken to push these forward.
Yes, first of all, let me start by saying that when we plan our advocacy, the adoption of a piece of legislation should be just one step that will then transform itself into implementation. So we've been struggling with this all across the board, I think, where we are very eager, and I am very eager to tick the box and say, yes, we have a piece of legislation that is tangible, that is specific, that is has an actor behind it. So that is when we have our advocacy achievement. But what we have to change, and we have really to plan for implementation even before the piece of legislation is adopted, because then we will anticipate what the needs are, b, who the actors are going to be, 3, the actors at local level, because very often these pieces of legislations are have as counterpart, as main actors, country level, so central government, and then when it is about implementation, it is local governments. And in countries like Indonesia, if I can use that example again, where there's a high level of decentralization, these decrees have really to be translated into provincial level. So in this particular case, for example, we took the national standard of care that were adopted by the central government, by Ministry of Social Affairs in Indonesia, and we decided to invest money and pilot the implementation of those national standard of care in 2 different provinces, 6 childcare institutions, translate those into even more practical standards, through the partnership of the local institutions, the directors of those childcare institutions, and then formed a whole kind of network around them of all the important people who needed to be there, monitoring mechanisms, reporting mechanism, because the actual goal of these standards is to license and get certificate of these childcare institutions. So that work has been tremendous in creating awareness that these standards exist, because central government sometimes is so far away and also so unresources and not recognized that we created that link between the central government and local government.
So it's basically you guys took the guidance and created a proof of concept in the pilots that you were running in those provinces. And from what I'm hearing you say, this is what really was able to get the attention of the government to move things forward. Do you think there's a lot of lack of confidence in policymakers when it comes to implementing big kind of international guidelines at local levels? Do you think that's something that people should keep in mind, or do you think there are other reasons behind kind of either slow uptake or a reluctance to roll out some of these guidelines?
I think there are different factors. First of all, central governments would tend to be much more subjected to showing off and international commitments. So it is national governments who come before the Committee on the Rights of the Child. There's national governments who have to respond to international inquiries, to UNICEF, to us, and therefore they're definitely much more open to being compliant. And of course, I'm not saying that is the only reason or driving factor, but that is my experience, a good one, especially for countries that are not completely isolated and still have some kind of openness to international community scrutiny and therefore influence. But then of course, local governments do not get that pressure, or if they do get it only indirectly. The other factor is money and resources. We all know how much, if you walk into the Ministry of Social Affairs in many of the countries where we work, it's not the most luxurious places to be. And that is not just about infrastructure. That is a reflection of, the level of importance that, child protection and social issues in general attract in terms of funding. So, of course, and that is where also we have influence, because very often we come with budget that they expect us to bring, and therefore there's some kind of power that we can exercise, but at the same time that can be a downside where we don't empower them to make that their own priorities, with or without Save the Children or UNICEF money.
Yeah, I mean, I think both of those issues in terms of the accountability to international and seeing a national government responding better to international standards than local, as well as the resources issue, is something that many of our countries are battling with, especially when we're seeing increased decentralization of implementation in governments. I know Kenya's just had a massive decentralization initiative begun there, where they're really trying to push at the provincial, or in some countries they call them state level, to deliver on this. What is some of the guidance that you would give to a country office about motivating local government to take forward implementation? They don't have the reporting to international bodies, the showing off that a national government does. And understanding the challenges with resources. But if they have resources, or if they're not motivated to access those resources, what have you seen that has been able to move the dial at the local level with some of this implementation from an advocacy perspective?
I think that the first tip that I would give is involvement of local government from day one. And create ownership of those reforms. So, if you push them in situations where they're just a mere implementer, and they feel that the local context hasn't been taken into account, that there are so much requirement but no resources, come in, they will immediately the first reaction will be rejection and or minimal implementation, nominal implementation. So, for example, when we organized a training, advocacy training in Indonesia to develop 3 strands of work. One was a campaign, one was an advocacy strategy, and one was the creation of a national level coalition to support all this. But when we were looking at the advocacy strand, we were immediately trying to work on both levels. What needs to happen at national level, and what needs to happen at maybe 2 or 3 provinces or district or subnational. Of course, sometimes we don't have the capacity to work all across the countries in all national districts or county or provinces, but maybe we can use 1 or 2 and then trying to engage and create that link between the local and the national, and trying to build ownership, participation, and commitment from the start.
Yeah, absolutely. I think that's a really good point, to make sure that when you develop your plans, you're looking at both national and subnational, keeping in mind the limitations of Save the Children's reach, but also thinking about your partnerships and coalitions that you could engage with to take those advocacy objectives further. So, Roberta, I want to move on to what is a very interesting area for Save the Children, especially right now. Liberia is in the midst of the Ebola crisis. What implications does this have on child protection? And you have an objective that's specifically on emergencies. Talk us through what is going to happen in the instance of the Ebola crisis, and how our child protection advocacy objectives link in with that.
In Liberia, we have had very strong child protection programming for the past 3 or 4 years, and it was supported by USAID, and we managed to develop a standard for kinship care guidelines with the government. Guideline for kinship care, foster care, and supported independent living, which was the guidelines were adopted by the Ministry of Health and Social Welfare in 2014. So that was a very good result, a long-term one, and those are absolutely essential now, in two ways. One is that thanks to this work, we were really able to engage with the relevant ministerial bodies, departments, who were our partners during the previous phase, but were completely included in the process of developing these guidelines, and therefore this relationship was already there. We could build on it in an easy way, and pushing them to step up to look at the Ebola response also from a child protection perspective. That perspective related to the fact that children are separated from the parents and their families. Some of them have lost both of them and therefore, are orphans. But the new challenge in this particular context is that it was very hard to ensure that children were placed in extended families, which is in West Africa, in many countries of the world, the most used forms of natural family-based alternative care. Why was that difficult? Because people were afraid of getting infected. Children, were carrying the stigma of the infection, and therefore, what we would normally be advocating for was not an option. Now, I understand that things have changed in the meantime, and therefore we managed to overcome that stigma, and so children started being reunited also with the extended families. But at the same time, we also promoted the opening up of an interim childcare center in Liberia. But what is important that the standards for that interim care center are based on the guidelines that were adopted by the government. So it is, of course, the needs are huge, and I'm not saying that this is the solution for everything, but definitely it is a nice follow on from how do we link humanitarian work with the long-term work? How do we build also preparedness for disaster and risk, and child protection in it in a natural continuum that will be sustained and built on, instead of having to start from scratch at every single phase.
Yeah, really making the best out of a bad situation. That's really an interesting kind of experience, and I hope we're documenting that, as I'm sure we can learn from that experience in Liberia. Do you want to talk a little bit more about the other work that we do in emergencies, and specifically, what is UASC, and what are the implications for Save the Children? What should we be trying to pursue in taking that forward?
So this is, one of the 1,000 acronyms that we use. And for PowerPoint, they are great, but it stands for Unaccompanied and Separated Children. So these are the children who, in an emergency situations, have lost contact with their parents. Or families, contacts in a broader sense, and therefore this might be the case of during a sudden onset emergency, when everybody's fleeing and they lost track of each other. And in conflict situations where there's abduction risks or attacks and on schools, and therefore very often this is a result of a survival strategy. But of course, these are also the situations where children find themselves at high risks of because of course they are not close to the adults and the safety nets, in the community or the large families that would provide for their care and protection. So if we look back at the breakthrough, this is a particular group of children that Save the Children also is known for having particular specific programs. So we belong to a working group on Unaccompanied Separated Children. We set up together with UNICEF IRC a management system to ensure that A, these children are immediately identified, B, that their needs are are assessed immediately, that alternative care for them, even if it is temporarily, is provided, that we do assess what is their best interest, that we do provide family tracing and reunification or long-term alternative care. And so we have been trying to reach this two worlds, so the world of unaccompanied and separated children and emergency with the world of alternative care, because we know in this world we all work in silos, and ensure that it's not only about family tracing and reunification, but it's the whole set of interventions that absolutely are needed to ensure that we take care and protect these children. Now, who does that? So, we know that in emergency responses, there are different actors according to the emergency, the scale of it, whether it is on set, whether it is a long-term one and a chronic one. In principle, of course, as we promote right-based approach to our programming. We know that the responsibility for protection and care of children is with the national authorities and the families, of course, first of all. But in terms of political or human rights approaches, it should be governments who have these services and capacities and networks, referral systems that ensure that these children are be given particular attention. So from an advocacy perspective, what we say is that when that is possible, we want, especially in preparedness, we want that in those plans there are all the actors identified to ensure that first of all, separation is prevented as much as that is possible. But when it occurs, that we know where to go, the families know where to go, children know where to go, in order to seek assistance and being then reunified if that is possible and in the best interest of the child.
Great. Thanks for that detail. I just want to ask if any of the listeners have any questions for Roberta or any examples of the work that she's been taking us through in child protection. If you aren't able to speak, for example, if you don't have a microphone, please feel free to type into the IM section of the link any questions that you may have. Roberta, so you spoke extensively about the need to, look at the, where relevant, the application of these guidance. What is the type of work, and this is a question I'm asking all of the global initiatives, is there any parts of this that are overlapping, the parts of the child protection advocacy objectives that are overlapping with any of our other thematic areas? And do you have any suggestions for staff on how they can either improve those links or actually seek out those links with their counterparts in a country or regional level?
Yes, absolutely. The work that we do, and this is my mantra. Some people would have heard me saying this all the time, that this global initiative, these silos that we have in our own organizations are artificial, and they correspond more to the way we organize ourselves rather than to how to comprehensively respond to needs of children. And I'm sure that from an advocacy perspective, that is even more evident, and if we look at not an example, just the latest one, unaccompanied separated children, the first thing that we have to ensure is that these children have civil registration, birth registration. They do exist. So and therefore that is where I see immediately the link with child rights and legal identity and the responsibility of government to set up systems to ensure that this is happening on a regular basis, that it is free, that it's not left to the goodwill of parents or local institutions. Secondly, very often in emergency response, children, what they want to see is one, being safe, protected, have a shelter, having food, nutrition, having the possibility of going back to normal. For them, going back to normal is very often going back to schools and not being disruptive. They're getting worried on how they continue going and getting their educations and building on their capacities. It is linked to livelihood and capacities of parents taking care of them. So if after a big typhoon, if we think of the Philippines again, the devastation that brought put entire families and villages and cities into very vulnerable situations of dependency. So the sooner we give opportunities to families and communities to be able to take care of themselves and therefore the children, the more likely is that children can go back to normal, can go back to school, instead of being asked then to contribute to family income, because that is becoming the top A priority. So how do we build all this in a coherent way is looking across health concerns and a higher level of mortality due to deteriorated hygiene conditions and not having access to healthcare facilities. So we see those links being very, very, very clear. It doesn't mean that we, and when I say we, is not the child protection sector, but all across the organization, that we are pushed enough to look at those linkages and in how to make those evident, how to be opportunistic, and how can we build into grants for other sectors element. How can we build protection in health? How can we build protection in education? I think that we should really explore more those. From a child protection perspective, it is a sector that doesn't have enough investment, definitely much less than what other sectors have. So from our perspective, that is even a need to ensure that we can continue to do this kind of work.
Yeah, a real challenge from Roberta to get us to not just look at things in silos, to look at the relationships between other global initiatives, other thematic areas, and to really try and integrate protection across the board and to make sure that it's being thought of, responded to, based on our extensive learnings in the work that we do. Well, Roberta, thank you so much for that overview. I think it's been incredibly helpful. We have a set of webinars which are looking at the advocacy within each of the global initiatives. If you look at the online training course, there is in fact no dedicated global initiative or thematic sessions, but in fact all of the sessions are pulling from examples from the many of the thematic areas. And the idea of these webinars was to really take a moment to show and to talk about how each of the GIs are pursuing the advocacy in their work and how they see that as helping them to achieve their overall objectives. So I'm just a last call for questions before I ask Roberta for her final thoughts. Again, feel free to just unmute your microphone or to type if you have any questions or examples of work that you perhaps have done that you'd like to share with us in the area of advocacy for child protection. Okay. Roberta, thank you so much for your time. Any closing thoughts that you'd like people to just go away with in pursuant of high quality advocacy for child protection?
Yes, I've been reviewing AMTs on child protection for the last 4 years, and this is an appeal to make sure that those tools are used not just because of compliance and because they have to do it is something that has to be done, but if we can transform those tools in tools that can enhance Save the Children programs and advocacy on child protection, that would be fantastic. I have been able to track progress on child protection advocacy through those AMTs, but also through the regular contacts that I have with the programs and directly or indirectly. But one lesson that I want to share is that whenever I see those AMTs, and when I look at what the objectives are indicated in those tools, if those objectives are formulated as activities and not as SMART objectives, it gives me immediately a sign that there is no advocacy plan that is out in the child protection program. So, of course, we're not calling for having a standard on child protection advocacy strategy, but to ensure that it is part and parcel of the program strategy that contains also specific advocacy objectives that we want to achieve. Advocacy is not something that you do temporarily. If you have the time, or let's organize a meeting, let's organize a webinar or seminar or a meeting with partner, or let's set up a coalition. Advocacy should be planned as much as programs. So if we see improvement in what is being reported, then it means that there is also an improvement of what is being planned and therefore implemented and monitored. So it's just a plea of considering advocacy as an important part of our program, and therefore devote time to plan, and because that is half of the success.
Great. Thanks for that, Roberta. And just to clarify for everybody, the AMT is the advocacy monitoring tool, and it is a reporting template that forms part of the country annual report. What makes it more than just a reporting template is that we pre-populate it with the data from the last years of work, so that it becomes sort of an institutional knowledge tool. It can tell us what advocacy has been happening over time in a country. But just reiterating Roberta's point here, making SMART, so clear and achievable objectives as part of your advocacy plan is really important, and to ensure it's part of the broader strategies is also equally important. If anybody has any questions on the advocacy monitoring tool, they're more than welcome to contact me, and we can try and help you with that. So with that in mind, the importance of making clear plans for advocacy, not leaving it an afterthought, I'd really like to thank Roberta for her time today, and to encourage anybody who's interested in child protection advocacy to contact Roberta directly. If you're interested in hearing what the other global initiatives are going to be saying on advocacy, please do go look at the OneNet page for the online training, and the entire calendar of webinars is available. What you'll also find are past webinars, the recordings of past webinars, if you've missed any. And you can watch those. They're on YouTube, and you can watch those at your own pace. So once again, thank you so much, Roberta, for your time and for your presentation. I will also make sure that the presentation is loaded onto OneNet. so people can also take a look at there. So thanks again, everybody, and have a lovely evening, afternoon, and morning.
Thanks, everybody. Thanks, Johnny. Take care. Bye-bye.